Thank you, Dr. Granstetter, for that very, very powerful message. And I have a lot to echo in that. And thank you for really setting the stage with those really key, important points. I'm very proud to represent Children's Healthcare of Atlanta. As many of you know, we are a 3-hospital system with over 650 licensed beds, just to put some of the information that I'm going to provide into perspective. And although I'm here today, I represent a team of thousands of people who have been taking care of children. And similar to Dr. Branstetter's story, we have been taking care of a number of children. Omicron has really disproportionately affected children, and more than the Alpha or the Delta surge, we are really facing a tremendous challenge in taking care of children. Just as a little bit of context, in the United States, over 9.5 million children have tested positive for COVID-19 in the United States. This is also the 23rd week in a row that over 100,000 child cases have been added per week. Georgia is the 15th state in ranking in terms of cumulative child cases. Here at Children's, as I mentioned, we had a surge in August, September, where we had about 10 to 12% of the children who were hospitalized in our hospital with either acute COVID or complications resulting from COVID. And the rate of positive tests ranged up to between 10 and 20%. In comparison, during Omicron, our test positivity rate has been over 50%, and our census has ranged up to 17% over the past 4 to 5 weeks. We've had over the past 3 to 4 weeks, more than 100 children with COVID-related complications, representing both acute COVID infections and continued hospitalizations for complications of COVID-19. Noted specifically in children as a post-infectious complication after COVID-19, known as multi-system inflammatory syndrome in children, or also abbreviated as MIS-C. To date, we've taken care of over 400 children in the Children's Hospital system who have been diagnosed with MIS-C. And while this does represent a small number of the total number of hospitalizations, children with MIS-C not only have complications that we take care of when they're in the hospital, but also may have some complications afterwards. So the way to prevent MIS-C is to prevent COVID-19. We are very fortunate that over the past several months, children have become eligible for vaccination. And now every child over the age of 5 is eligible for vaccination. Children 12 and above are eligible for a vaccination series, as well as a booster. Vaccination has been the mainstay in prevention of COVID-19, hospitalizations, and the post-infectious complications that I described. Less than 5% of our children who are eligible, age eligible, or condition eligible for vaccination have required hospitalization, meaning that over 95% of the children who we've seen in the hospital who are age eligible for vaccination have not been vaccinated. Once again, emphasizing the importance of vaccination in preventing hospitalizations. I also wanted to mention the importance of other mitigation efforts, such as masking, and also physical distancing and choices about social gatherings. These are extremely important for children, especially, as I mentioned, the children under the age of 5 are not currently age eligible for vaccination in the United States. Therefore, those children are completely dependent on those people around them to make sure that they are vaccinated so that they can, in fact, provide the most protection through mitigation methods other than vaccination to these children. This cocoon method really helps to protect children who are currently age ineligible for vaccination. I also wanted to mention that we've noticed both here at Children's in Georgia and around the nation that the number of children who are being admitted for hospitalizations are becoming younger and younger, especially during the Omicron surge. And this directly reflects the fact that those children are not able to be vaccinated. So if I could just please leave you with three really important thoughts. The first is vaccination, and I've said it many times, but please, everybody needs to be vaccinated, and most importantly, boosted as well if you're age eligible. This is really the mainstay of prevention and the foundation for keeping our children healthy. The second is universal masking whenever you're outside the home in every activity. And then also, in addition to the clinical and hospitalization rates that we've seen in children, I also wanted to mention the tremendous burden that children have experienced during this COVID-19 pandemic that extends beyond the number of hospitalizations, that extends beyond the data, that extends beyond the numbers. And so we need to do everything that we can coming together as a community to make sure that we protect the most vulnerable, our children. Thank you.